Dr. David Reath, a plastic surgeon in Knoxville, Tennessee. I wanted to talk to you a little bit about sunscreens, about what's effective and what's not effective. We gauge the effectiveness of sunscreens by something called SPF, Sun Protection Factor. And what many people get confused about is that they think that if you use an SPF of 50, it's almost twice as good as an SPF of 30. But it's not a linear scale. In fact, if you use an SPF of 30, you are blocking 97% of the ultraviolet B rays. Now, if you go up to an SPF of 50, you're only blocking 98% of the ultraviolet B rays. So nobody really recommends that you use a sunscreen with an SPF greater than 50. Now, they gauge sunscreens by how much of the ultraviolet B they can block. Ultraviolet B is what gives you the burning, the sunburn, and the tanning. Ultraviolet A is equally, if not more important, because it will age the skin and can promote the development of skin cancers. So we like to use sunscreens which block both. And some of the ones that are best are ones that have physical blocks. This is a cream that has zinc oxide and titanium oxide. This is a powder that does the same thing. These are very good sunscreens because they have a high SPF, 30 to 50, and they are effective against ultraviolet A and ultraviolet B. But the one thing you must always remember about sunscreen is they're only effective if they're on your face, which means, number one, use them, but number two, if you're outside and you're sweating or reapply, because once they wash off, they're no longer effective. But bottom line is, wear sunscreen. It's good for you. It's good for your skin. You don't need something more than an SPF of 30 to 50.